with the audio with some people, and hopefully this will help to address whatever that problem is. If not, let us know, and then we'll keep messing with it until we get it right. The reason for this press conference is that, as you may have known, we sent out something yesterday saying that for 2 days we were unable to give an accurate number in terms of new cases in the city of Cleveland and COVID-19 cases, and we were unable to give accurate numbers. And today's is really to explain to you how that occurred and the steps we have taken to correct that, because we want to give numbers every day and be accurate about it. But underlining all of this and our inability to do it, and to do it in a way that we felt that we were giving you accurate information, is the severity of this spike. Remember, now we've gone from being in the low teens to even single digits not too many weeks ago, to being almost 200 on one day, 190 something, and averaging around 160 something. So there's a process that the health department has to go through as they receive the information from the state, and then as they filter out all of that information, that data, and to determine which ones are city cases, which ones are not, which ones are accurate reportings, which ones are not. So that takes some time to do that. And again, this is a reflection of this spike and how severe this spike is. And we are redeploying resources and adding different resources, additional resources to address it. But I'll let the director come up and give you that process and give you some indication as to what we are doing. Okay, all right, Director.
Thank you, Mayor, and good afternoon. As the mayor spoke about the increase, the total number of cases have increased tremendously over the past 3-4 weeks. We've seen, just like in most health districts, a tremendous spike in new cases. Let's take, for example, on November 1st, we reported 44 new cases in the city of Cleveland. Just 10 days later, we reported a total of 194 cases. That's a multiple of 4. So the spike is real. It's increasing at a rate that is tremendous. So again, like most health departments, we're faced with adjusting our processes to meet the demands of this increase, to meet the demands of this spike, and to ensure that we're going to provide accurate information to the public. And that's what we're trying to do. That's what we're doing. So I want to talk a little bit about our process. The mayor talked about it a little bit. As we receive cases from the state, we receive those through our Ohio Department's ODRS, Ohio Department Surveillance System. This reports all diseases that are reportable within our jurisdiction. As we receive these requests, we have to identify those cases that belong within the city of Cleveland, and those cases that do not have correct information or missing information. That takes a little bit of time to research and to confirm that those cases are Cleveland cases. Once we confirm those are Cleveland cases, we assign those to our case interviewers. Those case interviewers are individuals that contact those cases to collect the information that is critical to help us identify, one, the most common trends and symptoms, but two, to also identify those who have been in close contact with those individuals. Once we generate that list of close contacts, we then begin to contact those individuals to make sure they're aware that they have been in close contact and provide guidance to them as well. So if you take a look back at November 4th and the 44 cases that we received, On that day, we received anywhere in upwards of 70 to 100 records in our ODRS system. We had to review those cases, and at the end of the day, we concluded there were 44 cases that belonged to the city of Cleveland. So as we move into this surge, not only are we receiving the 100+ new cases in the city and belonging to the city, but we're receiving additional cases and records that we have to research. So if we receive 100 new cases, we are going through anywhere between 150 records to confirm that they belong to Cleveland to 200 new records that are in there. And then we do this on a daily basis. So as the surge increases, we are increasing our capacity to address this. So over the past 2 weeks, we've identified internal staff to begin to train them on this process. So we increased the number of people who will be reviewing these records, researching these records, and identifying if they belong in the city of Cleveland. And if not, then they're transferred to those the necessary city. But then also this helps us assign these cases to individuals who will be doing the case interviews. So that is the process that we have in place, the things that we're doing to increase our capacity to adjust to adapt to the increase in cases. In addition to that, we are hiring additional staff to help us with this. We're working with employment agencies to identify skilled or experienced individuals that can help us with this. We have increased our internal capacity as well as us reassigning additional staff internally to help us address this need. So with that, I'll take questions.
Okay, if you have any questions for clarification, just let us know and we'll answer it.
Okay, Mayor, the first question is from Melissa Reed.
Mhm.
Will the city of Cleveland be enforcing Governor DeWine's curfew? And if so, how?
I learned of the governor's curfew earlier today. He gave us all of heads up. And that curfew really says, I guess, starting Thursday from 10 at night to 5 in the morning. We're reviewing what does that mean, in terms of those businesses. I believe he said on the call that there would be some exemptions to the curfew depending on what type of business. There'll be exemptions for people who are going back and forth to work, or whether they're driving or catching a bus or walking or whatever that may be. And so we're looking at what the implications of the curfew is, and then how can we best help to ensure that it is enforceable. It will be difficult in some cases. I can see if you have a business that's supposed to be closed at a certain time, that's a very simple thing. Are they closed? If there are people who are going shopping and they're allowing grocery stores to stay open, or certain businesses to stay open, we had to determine whether or not this person who is out after that 10 o'clock curfew is going to that business, or are they going to work, or all this other stuff. So we'll have to work through it to see what we'll have to do and what's the implications of it. So we're working on that, and I think it goes into effect Thursday night. So between now and then, we'll figure out what role we'll be playing in terms of enforcement.
Okay, Mayor, the next question is from Mark Namick from Channel 3. What wasn't the city ramping up sooner?
What wasn't the city ramping up sooner? What was it? What is the question? What wasn't?
That's his question. I believe we talked about mentioning ramping up staffing. So I think he's asking, why are we ramping it up now?
Why didn't we wrap? I'm assuming your question is, why didn't we ramp up soon? We did ramp up sooner. It is just that the pace of the spike outpaced our ramp up. So we did ramp up sooner. Like I say, we went from in October for low teens or single digits sometime, and to where we are now. And then, as the director mentioned, on November 1st, we went to 44 confirmed cases. And so we were ramping up. We were doing some things. There was some training going on with people around being able to manage the system, to collect the information, to process the data. It's just so happened that the spike out ramped up our ramping up. It was much faster and more severe in terms of the spike than we had capacity to handle at that time, and it demonstrated itself this past weekend. I think they're now. I think the system allows, if I'm not mistaken, the system allows for them to pull down 200 cases at a time, 200, and which means that they would have to go through all those 200 cases in order to determine which ones were valid, which ones were claimers, which ones were not. And then that would normally, and that's in and of itself a challenge. And then after they pull down to 200, there's another 100, 150. Well, that type of spike, we were not equipped to handle, even though we had ramped up to handle the increase as it was going along. We did not ramp up as fast as the increase was happening. And that's why on Sunday and Monday, we were unable to give accurate numbers. Now, we had numbers. We had numbers to give you, but they may not have been accurate because of when Monday comes around, in order to get to the Sunday numbers, you have to go through everything that's coming through on Monday. And you can only pull down 200 at a time, and 200 at a time with what they had to do was quite a bit. And after they did them 200, there's more. But we just didn't ramp up as fast as the spike occurred, but we were ramping up.
Mayor Mark Namick, also Channel 3, has a follow-up question.
Okay.
Thank you for the last answer.
He thanked me for the last answer. Okay. That usually means there's another one coming. Go ahead.
It's coming. But did the reorganization of the health department hinder your efforts to see the trends or be better prepared?
Did the reorganization hinder our ability to see the trend or be better prepared? The answer is no. The reorganization of the health department was the entire health department that deals not only with the crisis or the immediacy of the pandemic, but all aspects of the health department that is traditional health department stuff. So we had to keep that in place, as well as us moving into the new direction of creating this division of equity, health, and social justice. So that was the whole reorganization and revamping of the health department. We then went out and contracted for temporary employees for our tracing, and we were working on this aspect that we have a glitch in. We were working on that by moving people into there. Now, do we need additional resources? The answer is yes, and we need those additional resources, and we will bring in those resources through reassigning people and bringing in external help through temporary hiring agencies and things like that. But no, the reorganization did not hamper this or in any way impede it. It did not do that. This is a spike, and it's a severe spike. And it would not have mattered whether we reorganized or not. The question is, we didn't have the capacity to handle the rapidness of this spike. We didn't ramp up fast enough to meet the spike. And that has nothing to do with reorganization of the health department.
Mayor, the next question is from Bob Higgs from Cleveland.com. So how many cases were there on Sunday and on Monday?
We'll give you what we have tonight when we report out. I don't want to give you, I'll ask the director if he has some indication of what that is so that we could report it. But I know that what we don't want to do is give you inaccurate information. That is why we didn't report. We have numbers, but we couldn't give you total accurate because we couldn't give you total amount and all this stuff. But I'll give you the director so that he can respond to as best as he can as to what he believes Sunday and yesterday is and how it's trending today.
Thank you, Mayor. So for Sunday, the numbers for Sunday, we haven't finalized those, but we know that there are in excess of 100 new cases reported in the city of Cleveland. As we work through all the cases that we've received over the past 2 days, we'll be better able to identify exactly and correctly the total number of positive new cases in the city of Cleveland for Sunday, Monday, and Tuesday. But that is our goal, is to provide accurate information to the public. So we'll be working towards that to get that out as quickly as possible.
To follow up on that, to give you a little bit more meat on the bone, is that we do know that whatever the average trend has been in terms of reporting of new cases is usually up about 150 or so, is probably at least that or more. Is at least that or more. We know that for sure. It's not going to be anything less than what the average is, and in all likelihood, it will be above the 150 or 140, or probably be up to around 160, 170, up in that area. But that's the preliminary without doing the final stuff, and we don't want to give you inaccurate information. Our goal is to have, if I'm correct, Director, our goal is to have the accuracy of today and yesterday, Monday, reported out today. Is that right? That's right. So when we do our report today, we will at least have today and Monday is our goal for now, and then we'll pick up as we finish up Monday and Tuesday and able to then deal with the rest of Sunday. Then we'll give you an accurate picture of that. But even Sunday will be similar. It will be above what the average is.
Lisa Ann Ryan. Hi, this is Lisa Ryan from 90.3 WCPN Idea Stream. Just three questions.
All right.
The first
one question at a time.
Why are other cities and counties not having the same issue reporting cases within their jurisdiction?
The question is, why are other cities and counties not having issue? I don't know if they're not having issue, and you have to ask them if they're doing anything different than us. I know we all get our information from the same source, and our goal is to have accurate reporting. Is there other cities and counties having similar problems?
Mayor, I can't speak to that.
The director said he can't speak to that either. He does not know if there are other cities or county. I do know, I think the county reports, twice a week? Once a week. We report every day. So, and we do that for a reason, because we want to keep the public up on it. We could go to once a week and then, and have it, we would have more lead time to clean up or to come up with a number. But I don't know what other cities are reporting every day as we do. But I really don't know if they're having a problem, if they're not. I know that we got an issue right now and we're addressing it.
Her second question, again, Lisa Ryan from 90.3 WCPN Idea Stream. Why weren't policies put in place so you'd be prepared for the spike?
Why weren't policies put in place so we'd be prepared for the spike? There were policies put in place, and there were not only policies put in place to deal with the pandemic, there were things that we were executing on in terms of bringing on resources for that. This spike, as I said to Mr. Namick, this spike outspiked that preparation that we had. It's just that simple. We had more cases happen quickly and in a short period of time than we were able to handle. If, believe me, if we were able to have predicted that, then we would not be in this situation. We did know that it was going up. It was going up at a pretty steep rate, and we resourced and reprogrammed and did things in order to handle it. But it's apparent that we missed out on 2 days, at least 2 days of being accurate. We could have given you numbers, but they wouldn't have been accurate. And so we don't want to give accurate numbers, inaccurate numbers.
Homa Bash from News 5.
Mm-hmm.
Can you link this severe spike to any specific activities or gatherings? Like what is causing the 4-time increase?
Now, from what I'll turn that over to the director as they're doing the contact tracing. And the question is, what is the link that we can, what is the link to the spike? What activities or what is occurring? I know that there's a lot of conversations around restaurants and bars and barbershops, beautician shops. But what we find as we're going out doing our enforcement, that the ones who intend to do right are in compliance. And it doesn't mean that there may not be some tracing back to a bar or a restaurant or a barbershop or beautician shop, but we find that not to be the significant side of the spike. What we're finding, and again, I'll let the director talk about it, is we're finding that it's more about independent, individual kind of stuff, or friends and family members getting together in close proximity to each other in a house or something like that, that is really what is the primary cause of the spike. And so, Director, if you have any other.
So, well, what we do know, this is community spread. It's everywhere. We've identified a number of areas in which we see a number of cases. Some of those cases aren't linked. So, for instance, if we still receive complaints in identified cases from restaurants, from social gatherings such as wedding receptions or funerals or repasts. These small social gatherings are where we are really seeing an increase in the number, and it's contributing to the spike. But we do recognize this is everywhere. It's impacting every business throughout our community. Healthcare is impacted. School are impacted. All our city program departments are impacted. We're seeing cases everywhere. So we know that we know that COVID is everywhere, and it is being spread among us. So that's why we implore, we request that everyone follow the guidelines that are set by the state and set by our local government. Stay inside. Travel when you absolutely have to. Always wear your mask. If you're in close settings, make sure that you're 6 feet apart. These are things that we know, and including washing your hands more routinely, using hand sanitizer if you can. These are things that we know will help mitigate the spread. But I think the key is we have to be aware. We have to be conscious of what we're doing at all times. Behavior change is difficult. We recognize that, but we are requesting that we all look at our own personal behavior and take the steps necessary to protect those that are close by, whether those are family members or whether those are just friends or associates. Wear your mask, stay 6 feet apart, and continue to wash your hands routinely.
You know, and the director brings up an important point. As you know, the governor made an announcement, I think it was last week, and where he put some restrictions on repasses after funerals and weddings, where they found that to be a major trace back to that. But he makes the point, and rightfully so, that the virus is everywhere. And so wherever there's social contact, whether business or socially. Where there's contact with people, there's the opportunity to spread, and that's why staying at home if you can, and if you have to go, mask, social distance, and washing your hands is the key, because it is everywhere. And those establishments that have taken the precautions to enforce what I've just outlined to you tend to do a better job than when you go to gatherings of people and come into contact with each other, and they don't do that. They don't wear masks. They don't keep social distance, those kind of things.
Mayor, the next question is from Casey Robson. How are you supposed to follow the quote unquote suggestions imposed by Governor DeWine? If no clear directed orders are in place, no one will follow, unfortunately.
Well, the question is, how do we expect people to follow the mandates coming from the state if there's no clear direction? I think the point was. Well, I always say that you got a group of people who are going to go do right no matter what. You got a group of people who are going to do wrong no matter what. Most people just do whatever the rules are, whatever you make them do through the rules. And so in that sense, you're absolutely right to have a clear guidance as to what the expectations are, and then some consequences to not following those directions is the best solution. To have you may or you should, or it would be nice if you follow the rules, it has less of an impact, and people tend not to take it as serious. So I agree in that sense.
Mayor, the next question is from Ronnie Sia. What are the qualifications for the new city job opening?
It depends. What are the qualifications for this new city job? I'm assuming that the question is around COVID-19. There's a job description. When we go through a temporary hiring agency, we give them the job description, which is the quickest way of bringing people on. And they then find people who are retired or out of work, but they have experience in doing certain things, so they bring them on, and then we use them. We post jobs, and there is a process for that. Darnell, the general process for hiring is we post, and then what?
Post, Mayor, and then interview.
Can you just say?
Generally speaking, we post internally, we post on the internet. You can go online and go to civil service office, and basically read the posting and then apply online. That information is forwarded to the user department division, and they'll be in contact with those folks that do meet the minimum qualifications for that posting.
And the issue there is always the time that it takes to do all that. And because they're depending on what the classification is there a civil service test that has to be given, because these would be classified positions, civil service test, or is it a test by resume where they do interviews? If it's a test by resume where they do interviews, is much faster than if you had to set up a formal test, and then people take a test, they rank the test and the people according to how they performed on the test. You have a list and you hire off the list. So this is, government has a procedure, a process for that, particularly when you have classified civil service protected position. That is why many times we will look when we have emergencies, we'll do outside contracting with agencies for temporary help, or we'll hire a firm or a consultant to perform that work during that emergency while we're setting up the process to hire permanent people. And again, if it's through resume, then that knocks off quite a bit of time, because you don't have to get a test, set it up, set a date, give a test, score the test, rank the people, and all of that. So it is a process. And that's why we do outside resources with firms that have temporary, or with firms that do specific tasks, and we hire them in emergency situation until we're able to work through the process.
Mayor, the next question is from Tracy Carlos from Channel 5. She says, hello, Mayor.
Hello, how are you?
Are you considering a private gathering measure like Akron passed last night?
And could you, am I considering a private gathering measure like Akron passed last night? Had a conversation today, I was with some mayors, and that got brought up where they were passing something in their council. I don't completely understand what they passed, but I do know it is around limiting people, I think limiting 6 people in a gathering. And I know that right now we have a public gathering limitations of 10. And when you go to these receptions at the weddings, or repasts at the funerals, or banquet halls, they actually allow for 300 people. And so that becomes an issue. The question becomes with if I'm understanding the ordinance, or that was passed last night, if we have 6 people as maximum, are you talking about in somebody's home? And if you're talking about in somebody's home, the question is, how do you enforce that? Do you just knock on doors and say, is there more than 6 people in your house? Or is it driven by enforcement, driven by complaints? Somebody calls on somebody and say, well, there's more than 10 people in it, 6 people in this house. So that's the difficulty of this, that process. Just like on the, where you can have 300 people at wedding receptions and repasts for funerals and banquets, it's kind of difficult to enforce that because how can you keep up with all of the funerals and banquets and weddings that's occurring? It would be simpler to just say that you can't do it. And if you can't do it, then if anybody's having one, then they're in violation. It gets even more difficult, however, if you're going into a private residence. And how do we, as government, enforce 6 people in a private residence? Again, I haven't read the legislation that they passed, but in a brief conversation today, where they were talking about not just in Akron, but Dayton and Columbus and other people were talking about doing something similar. The question did come up about whether you're talking about in somebody's home, or we're talking about in public, what are we talking about, and how do you enforce it?
Mayor Tracy C. stated, FYI, the mayor, Akron limited gatherings to 6 with masks required for the next 30 days.
Right.
With police enforcement and a fine of $250.
Right, the $250 is, I don't know if that's civil or criminal, but in any case, even with that being said, what are you going to do if you're going to just go into people's homes and inspect and see if in fact there's more than 6 people there? I can see if they're talking about no more than 6 gatherings, does it apply to restaurants? 6 people in a restaurant with masks? Does it apply to 6 people at a funeral with masks? How does it apply? Does it apply to bars? I don't know how it applies. I'm assuming, but the only assumption I can have is that they're saying 6 people in a private setting. And the question is, how do you enforce that? And first of all, how do you become aware of it? And then how do you enforce it? Now, that's a practical side. I'm not criticizing the effort, because these are efforts that mayors and county officials and state officials now are trying to make, to see what can they do to stop this spread, to stop this spike. because as the director said, is everywhere now. And what can we do to stop it? And the real issue, as people are talking about this, and particularly from the medical point of view, the health side of this, is that we have to keep people from coming in contact with each other. And if they do, and so how do you do that other than shutting it all down? Again, which is really the challenge that the state is facing now. Do we shut it all down again, or do we just allow it, but put more restrictions on it, even though we know that a lot of these things will wind up being voluntary because the practical side of enforcement is not there to a great extent. So that's what's going on right now. And so I'm not faulting anybody. People are just doing what they believe is they have to do, and attempting to get people to comply and to do those things necessary, and to say that if you are, like they even say with 6 people, if you're going to be in a gathering of 6 people or less, you're still going to have to wear a mask. See, all that is an indication of the severity of what is going on. Then the community spread that's going on, the spike in new cases that's going on, and it has put a tremendous burden on all of the infrastructure of government and the private sector and the hospitals. Because now we have to, even though we have to function, even with this increased spike in the demand for services that it causes and the impact it has on all of our operations. All this is, these are conversations are going on right now, and they're going on because people are trying to get, governments are trying to get, and the private sector too, hospitals too, are trying to get a hold of this thing and try to prevent or slow down this community spread, because the community spread is already here, as the director has said.
Kim Palmer from Cranes. Are more of these increases in cases coming from infections at places of employment as the spike in community spread increases?
I'll let the director, where are they coming from is another, is asking the same question a different way. This is from a business perspective, saying, are these new cases coming from employment or things like that? I'll let the director respond to that, but they're coming from everywhere. And what we find is where businesses or gatherings or whatever it may be follow the rules, you have less of a spread and less of new infections. It doesn't mean you eliminate it, but you have fewer of them because they're following the rules. The mask, social distance, washing their hands, desanitizing, all that. Where you're having the biggest spread is where people just don't follow the rules. But Director, do you have an answer to that?
So we are seeing a number of cases throughout businesses around, and it's been, I think, sobering that we have seen a business reporting these cases to us, and these are not. We have not been able to link these to individual businesses, but we are seeing and receiving reports of positive cases that are coming from the business community in a number of different areas. Again, it's community spread. It is not a result of businesses not following the rules. Businesses are have been typically good, have been adhering to the guidelines, enforcing sanitization, as well as requiring wearing masks in their business. But people outside of that, when they come, before they get to work, they're spending a lot of time together.
Director, when you get these reports, you don't get them from business, you still get them from the state, and then you track it back to businesses? How does that work?
So let me clarify that. So in addition to receiving positive cases from our surveillance, the state surveillance system, We also, as businesses learn that their employees have tested positive, their first step is to contact the local health department. And we've, over the past month or so, we've seen an increase in these self-reporting businesses when they have identified or employees have reported to them that they tested positive. We'll confirm that through our system, through our normal process. But what this helps us do is helps us give guidance to those businesses of how to clean property, what steps they should take to, and how they should notify their other employees. And those are the efforts that I think have to be commended to those businesses that are reporting to us. But also, we know that we do verify and confirm that through our normal process.
And I'm assuming, Director, that many of these cases are not new cases that reported, many of them, probably not all of them, that people got infected at the business. It probably, since it's community spread, people come to work and they're infected. Is that the way it's happening?
That is correct, Mayor. These are not cases that we're linking to the business or the organization. These are just cases that have been areas in which they're working, not necessarily that they're linked to one another or that they're as a result of businesses not following the guidelines that are in place.
And many times that's what he just explained is applicable to barbershops, beautician shops, restaurants and bars. You know, when people come there, and if since this is community spread, people bring it many times, and then they infect others there. So that's what happens to people who are infected there. Then it gets traced back to there.
Mayor, the next question is from Amber Moore.
Mm-hmm.
With a handful of confirmed cases among City Hall employees, why has the building not returned to telework?
The question is, with a handful of people who have contracted the virus, who work at City Hall, why haven't we returned back to telework? We have. At my last press conference, I mentioned that we had, like businesses, we had put in place all those protective things in terms of plexiglass, distancing, released other space outside the City Hall so we wouldn't have the congestion. We did all that, but with this spike, we realized that we couldn't bring people back 5 days a week. So we're going back to the hybrid model of working, some people working from home, some people coming in, some people working at home one day, coming in another day. And we're doing that because we found that if you do completely virtual, that the work doesn't get done. And so people wind up not being able to get permits, get licensed, to get birth certificates, death certificates, get inspections, get all these other kinds of things. So we're figuring out how can we maintain and ensure service delivery while at the same time creating that safe environment for our employees. Now, we made millions of dollars of investment in terms of the physical space and leasing other space, and we intended to bring everybody back 5 days a week until this new spike occurred. And now that the new spike has occurred, then we're going back to the way we were operating before. We had also intended to have City Hall open to the public with protocols of wearing masks, taking temperatures, and only allowing a certain number of people into a certain space depending on the size. But that has been pushed off indefinitely now. But our first step was to physically make the working environment safe, protect people by checking people when they came in, employees, to make sure they didn't have symptoms. And then after we did that and brought people back and got people acclimated, then we were going to bring the public in. But all of that has changed now. So we're going back to where we were before, where some people are doing virtual, some people are in person, no more than 3 days, even in person at City Hall. And even that is staggered depending on on the operational needs of that particular department.
Follow-up question from Bob Higgs from Cleveland.com. Regarding enforcement of the governor's curfew, will this come with criminal charges attached to it as the governor's mask order did? Cleveland balked at criminal charges and enacted its own mask regulations. Do you envision that for these new orders?
Well, the question is, in our enforcement of how we decide to enforce the governor's new mandates, he has, in his mandate, they're really misdemeanor 4s for violation of the mandate, which is a criminal charge with $250 fine maximum, and I think 90 days in jail maximum. But the city of Cleveland, rather than enforce a criminal charge on people, we went to a civil penalty where it's not if we give someone in violation, we won't charge them with a misdemeanor 4 and have a criminal charge. We will do a civil charge, which is really a fine. You get a ticket, you have a fine, and it's civil. And the question is, how will we handle this new mandate around curfew, I guess, the requirements that he's put on in terms of receptions after weddings and repasts after funerals and things like that. We intend to follow what we have right now, and that is to continue our civil penalties associated with the mandates that have come out of Columbus and the mandate that we have imposed via our city council passing legislation. I will also say that whenever there are businesses and establishments who have not complied, they get a warning at first, and then after that, I think it's $1,000 fine, and after that, it goes up to $3,000, and then there's a fine every time thereafter, and they're not in compliance, and it escalates as it goes on. So we're with the average citizen, those fines are not that severe. Walking down the street without a mask, or to be in a situation where you're not wearing a mask, that's a little different. With businesses, it's more severe, but they're all civil penalties. They're not criminal penalties.
Kim from Cranes again. Are Cleveland companies required to report known positive COVID cases to the city or state, or is that an individual responsibility?
The question is, are businesses required to report COVID-19 cases that I guess they're aware of with their employees to the city or state? Director?
So that's the recommendation from CDC who for businesses who have positive cases. The purpose is for one to notify the health department, but also for the health department to give guidance to those businesses how to properly clean, how to address or inform their employees of what has happened.
Is that a requirement or voluntary?
Legislation.
It is voluntary. It's a guidance. It's not required by local or state guidelines or regulations.
Okay.
It's part of the order. But if they have a positive case, they have 24 hours.
What I'm told is that our ordinance in the city of Cleveland, if there's an establishment where there's a positive test, then they have 24 hours in which to sanitize the establishment, or if they don't, then they're closed until such time as they do. But her question was on the reporting, and the director said that that's voluntary right now, according to the state guidelines, I guess, coming out of the state health department.
CDC.
Coming from the CDC.
Casey Robeson asked, what is the process of bypassing these suggestions and implementing your own orders within your city? Is that possible? Obviously, there's a chain of command, but I'm
the question is it possible for us to be more stringent and bypass whatever the state says. That's, I'm summarizing, but that's what I get out of this. And the quick answer is yes. The governor has actually said that he is setting the minimum requirements on things, and that local communities can do things more harshly or more restrictive if they desire. Now, that, however, has a practical side to it, as I've mentioned before in these press conferences, that the city of Cleveland doesn't have a plexiglass around it where you have one point of entry and you can check everyone coming in as to whether or not they have symptoms or things like that. We don't have a thing if you're coming from a certain suburban community or a certain state or a certain other part of the state of Ohio that you have to quarantine. So we don't do all those checks. We don't have that kind of people entering the city of Cleveland. So on a practical side, it becomes very difficult for us to implement something that is not a broader statewide implementation. And the other side of that, say for instance, we decided that we were going to close down every business, whether it was manufacturing, office, retail, commercial, everything. We just close it down for the city of Cleveland. How much impact that would have in terms of significance in regards to the overall state problem,